Calcium plays an essential role in keeping our bones and teeth healthy. But calcium also helps with muscle contraction, blood clotting, and nerve signaling. About 99% of the calcium in our bodies is stored in our bones and teeth. This acts like a reserve that keeps calcium levels in our blood normal. When less calcium is available for other body functions, our body takes calcium from our bones to meet short-term needs. This process is called bone resorption. It is mainly controlled by the parathyroid hormone. Bone resorption can happen for several reasons: not getting enough calcium, vitamin D deficiency, hormone changes, or certain foods that make our body pull calcium from bones. In this article, let's learn about 7 foods that might take calcium from your bones, weaken them, and disrupt body functions. 1. Sugar. When you eat sugary foods, your blood sugar rises sharply. To counter this, your body releases insulin to bring blood sugar back down. Higher insulin tells the kidneys to remove more calcium and sugar in urine. More calcium gets lost this way. To make up for the loss, your body takes calcium from bones. Over time, this bone resorption weakens bones and can lead to osteoporosis. Studies show that for every 100 grams of sugar eaten, about 6 milligrams of calcium gets lost in urine. The average American eats over 17 teaspoons of added sugar daily, more than twice the recommended amount. This starts a cycle that threatens bone health. Too much sugar causes weight gain and poorer bone density. Keeping sugar intake in check protects your sweet tooth and bones. 2. Caffeine. Caffeine in coffee, tea, energy drinks, and some sodas can reduce how much calcium gets absorbed by your body. These drinks prompt more calcium to leave the body in urine. This happens because caffeine causes more parathyroid hormone to get released. This hormone signals bones to put calcium into the bloodstream. While this may quickly fix low blood calcium levels, over time it contributes to weaker bones. If you love caffeine, you need not cut it out entirely. Just be sure to get enough calcium from dairy, leafy greens, fortified foods to make up for the loss from excess caffeine. 3. Excess protein. Our body tries to keep pH in a tight normal range. But when we digest protein, byproducts like sulfuric and phosphoric acid get created. To neutralize them, our body uses calcium. Calcium binds to these acids, forms soluble salts, and leaves the body in urine. This calciuresis maintains pH balance. Studies link high protein intake, especially from animals, to more calcium loss. Research shows that for every extra gram of protein eaten, an additional 1.75 milligrams of calcium gets excreted in urine. This can gradually diminish bone health over time. You needn't stop eating protein. Men need 56 grams daily, women need 46 grams. Just mind your portions and total intake. 4. Vitamin A. Vitamin A is vital for vision, immunity, and skin health. But excessive retinol formed from animal sources can interfere with calcium metabolism. Retinol spurs osteoclasts, cells that break down bone tissue. While some osteoclast activity enables healthy bone remodeling, too much vitamin A overstimulates it, causing bone loss. Vitamin A toxicity is possible, especially from supplements. Studies show women taking high vitamin A supplements had over twice the risk of wrist fractures. Getting vitamin A from a balanced diet is likely safe for most. 5. High-salt foods. The more salt consumed, the more calcium gets lost in urine. Packaged and processed foods often make up too much of the average American diet. While adults should limit sodium to 1,500 to 2,300 milligrams daily, average intake is around 3,000 to 4,000 milligrams. Besides raising blood pressure and disease risk, high salt use also threatens bone health over time. 6. Alcohol. Alcohol directly hampers the gut's ability to absorb dietary calcium. Plus it spurs and impairs osteoclasts that break down bone tissue. Studies associate heavy alcohol use with higher fracture and osteoporosis risk. Per a 2013 study, women having 2 alcoholic drinks daily had 3.5% less hip and 5.7% less spine bone density versus non-drinkers. A 2017 study linked just 10 extra grams of alcohol daily to 16% higher hip fracture risk in women. 7. High-oxalate foods. Spinach, beet greens and rhubarb have oxalic acid, a compound that blocks calcium absorption by binding to it. This lowers calcium reaching your bloodstream. Your body may then draw from bone reserves to keep blood calcium normal, slowly impacting density. While moderate oxalates are likely safe for most healthy people, those prone to kidney stones or calcium deficiency should watch intake. One study associated high-oxalate diets, greater than 300 mg daily, with 6% lower bone density in women. Maintaining balance between calcium intake and high-oxalate foods is key. If you have bone or calcium concerns, consulting a doctor or dietitian is best.